Hi, my name is Rick Munaretto, and I'm the director of Wayne Dentistry Seminars, and I'm an endodontist. My specialty tip would be to utilize cone beam with your endodontic treatment planning. If you're doing comprehensive treatment plans, whether they're for implant dentistry or they're just part of the treatment plan, and there's teeth that have had previous root canal treatment, it's a good idea to have your endodontist take a look at that cone beam and evaluate the status of the endodontically treated teeth. You know, we can see a lot more with cone beam. We can see missed canals. We can evaluate the current root canal for length, taper, and density. You know, we can't evaluate the seal of the root canal, so we don't know if it's leaking, which would cause later post-treatment disease. But we can get a better idea of the status of that root canal, whether or not we can get involved early to retreat it prior to the treatment plan. You know, cone beam allows us to see external and internal resorption, which never could be seen to that, you know, and actually diagnose it at an accurate level. From a trauma perspective, horizontal root fractures, you can actually see the degree and angle of the chisel fracture. If it's an intrusion or an extrusion injury or lateral luxation injury, we can actually see how severe the injury is even before we go in. You know, I think a lot of trauma cases, dental trauma cases, are misdiagnosed. You know, people think, oh, it's an intrusion injury, when in fact really it's a lateral luxation injury, and we can see all that using cone beam. So you know, the evidence over the last 5 to 7 years is really, you know, it's really the standard of care with a dental trauma case, getting a cone beam, especially if it's in the upper anterior. And I think the outcomes of that treatment is going to be a lot more predictable if you utilize cone beam.